Hello, and welcome back to 10 Minutes With. Today, I'm joined by Matt Bolz-Johnson to discuss the intersection of rare diseases and mental health. Welcome, Matt.
Hello, Rhiannon. Nice to see you.
Thank you. Could you start by introducing yourselves and what you do at EURORDIS to the people at home?
So my role at EURORDIS is I'm the mental health lead.
Mm-hmm.
I was active in the healthcare team on the European reference networks,
Mm-hmm.
and it was through the working with the patient representatives for all the different conditions that the mental health became clear as being a real priority. And so I stepped into leading the work we do on mental health.
And can you give a very brief explanation or a brief overview of some of the things that we've done thus far?
The first thing which we did was to provide a platform for our community to come forward. We developed a mental health partnership network where patient representatives could come together, clinicians, researchers, psychologists, and connect and support each other. I think with the mental health topic in rare diseases is been for a long time overshadowed.
Yeah.
And from the other medical complexities which we want to try and sort out, which is finding a diagnosis, finding research to push for a cure, access to treatments. And when we're not doing those things, we're alone. And it's when we're alone that the psychological impact of the rare disease journey really comes home. So the Mental Health Partnership Network was about creating a space for people in the community to come together, to be seen, to support each other, and really to understand that their mental health matters. And I think that's a really important message, that people don't feel alone and feel that they are in a space where they can talk about these challenges which impact on their mental health and well-being.
And could you expand a little bit more? What are the biggest challenges facing the rare disease community when it comes to mental health?
Rarity comes with a set of characteristics like chronic uncertainty. You're being given a diagnosis around a condition where actually the prognosis is unclear. What's treatments available is unclear. What's effective. And living with that uncertainty over time, it really impacts on levels of stress and anxiety. And also with the pathway, the rare disease journey, we have people suffer from multiple trauma. On average, it takes about 8 times to see 8 different specialists you see before you get a diagnosis.
Goodness.
Each one is saying to you, actually, we don't know what's wrong with you. I don't know as a specialist, as an expert. Maybe is it all in your head? Is it psychosomatic? Maybe you have too high expectations of yourself. And that rejection and lack of validation or finding out what's wrong really becomes quite traumatic. You can maybe be misdiagnosed, how that's handled. And so actually people in the rare disease community live with actual medical trauma from living through that experience. And so there's a range of features around the rare disease journey which really impacts on not just the individual but the whole family.
And so what is the role of patient groups like EURORDIS but also others in the space of combining physical healthcare and mental health care?
I think something which is a bit under recognised is how important patient communities are. When you have something like tuberous sclerosis, you meet other people who go, sorry, what condition? You meet with 90% of anyone in the healthcare service which has never heard of the condition. That's isolating to the families which are, their child has tuberous sclerosis. But when you connect into a community, a TSC community, and you're all of a sudden in a room full of people who understand your experiences, you feel seen, your needs are legitimised, and it's a game changer.
And so how can organisations go about building mechanisms to create that peer support?
I think, whilst each rare condition on a physical level are quite diverse in their needs and presentations, there's quite a lot of commonality around the mental health needs. So we can learn from different patient groups on how they've approached this. how they put in things to enable people to have access to trusted information, to reduce that level of uncertainty, to know how to give support for how, when you're going to see your medical appointment, and you're not just going in to cover have my tumours grown, but how to make sure that the wider needs, your holistic needs, are being addressed. So there's some really good tools out there, and we're just pulling together a toolkit which showcases all of them, and we can then learn from other communities and see, well, does this work for your community, and see whether we can transfer it. So it's quite exciting to learn from each other and to put that in a more accessible way.
Yeah, definitely. And I assume as well that there is a need for a similar such toolkit or mechanism for training healthcare professionals in the specific mental health needs, or the specific mental health complexities, shall we say, of rare conditions. Does that exist? Is that something is that a gap that you're working to fill?
I went to the Netherlands last week to meet some trainee clinical geneticists, and it was clear that they understand genetics, but they hadn't really the understanding of the full impact of rare conditions have on people's lives, and
as a human as a whole.
Yeah, completely. And you don't get training for how to deliver a diagnosis.
No.
So there is tools out there. There's we work in partnership with Rare Minds, and we work with Medics for Rare Diseases, and they did some online training which is free, which is Rare Diseases 101, and there's a mental health module in there, and it really helps to familiarise professionals with what they can cover and what they should be mindful of.
And now, to address the people at home, so on two different things, but firstly, where would you pinpoint or point someone in the direction if they themselves are maybe living with a rare condition and need help with their mental health?
I would say connect with your patient organisation. It doesn't have to be one in your country. It could be one of the international federations. It could be through a national alliance, and they normally can help in terms of providing some support. It's informal, it's not professional support, and it can be on an individual level, or it can be taking part in group activities. That's really effective. Other national alliances, like in Luxembourg, they also provide psychosocial care as a clinical service, and I think it's a really innovative model. So the Ministry of Health or the Department of Health fund the National Alliance to provide this.
Wow.
There's psychologists and social workers working there, and I think this model is brilliant because you're not having to go to a mental health service for professional support. You're going to a patient organisation.
Someone you may already be in touch with as well if you're in the community.
Who you're in touch with, and the stigma isn't there.
Yeah, of course.
So you're going to meet people who understand rare conditions and can provide the support you need and tailor it. So I think it's a brilliant model. It was actually recognised by the European Commission as an area of best and promising practice last year. So we're advocating that other rare disease plans which are being updated, that we give greater visibility of mental health needs in rare diseases, and the actions like Luxembourg, what they've done in Luxembourg, that can be replicated in different countries.
And speaking of the European Commission, if you could change one thing about the mental health field, if you could make one fundamental change that you think would have the biggest impact, what would it be?
What we know from the evidence is that someone living with a rare condition, their mental health and well-being, their quality of life is improved when it comes to when they get the right support. And a lot of times the main caregiver, the parents or the partner, don't think of themselves. They always put the individual living in the condition first. But we know that if you do look after yourself, and when your mental health and well-being is good, then actually that has a positive direct impact on the person you love. And so think about looking after yourself. Think about just giving yourself some time to do something which refills your resources, whether that's swimming, reading, meeting friends. But do that because it has such a positive impact on the person you care about.
It really is a community effort.
Yeah, completely.
That's such a lovely sentiment to end on. Thank you, Matt.
Thank you.
You have been watching 10 Minutes with me, your host, Rhiannon Walls. Make sure to tune in next time.